Hi, how you doing? Dr. Jake Anderson here with Essential Motion Spine and Sport.
Dr. Erickson, EHS Physical Therapy and Chiropractic, thank you so much for watching. We wanted to talk to you about some exercises, our top 3 things that we use for employees that spend the majority of their day in a chair and sitting, right? So we often help adults, busy adults like yourself, that are frustrated with spine, joint, muscle pain, regain confidence in their bodies, regain strength. Even if you've tried physical therapy or chiropractic in the past, there may be some different movements that you haven't tried yet. So where do we want to start here first, Jake?
Yeah, let's go ahead and pull up the chair here. And we'll dive right into it. So let's just talk about sitting posture here first, Chris.
Most important thing is to get yourself set up in the proper position. Otherwise, by go ahead and demonstrate having the slouch forward. As soon as you get some flexion through here and slouching in the lower back, it automatically brings the head forward, which rounds the spine out to kind of a big C curve. So you got to slide your hips all the way to the back of the chair, let the lumbar support kind of curve that lumbar spine back into that curve, and then it instantly brings your head and ear in alignment with your shoulder. So number one, you got to set yourself up first, because you have to get here first before the other exercises we're going to do will even be effective. So number one, get here, and then number 2 and number 3, Jake, go ahead and show us what we're going to do with the retraction and the thoracic extension.
Yeah, so this one's called a chin tuck or a retraction. So what you're going to do here is you're going to sit up nice and tall in the chair like we've already discussed, and you're going to pretend there's a string pulling your head to the ceiling. So you want to elongate the spine, right? And then pretend something's coming at your face, and you're just going to tuck that chin straight back. So you're not going to be looking down, you're not going to be looking up, you're coming straight back. Mm-hmm. And what this movement is doing is it's working on where the neck and upper back meet. We're getting some movement through those joints, and we're targeting kind of where the base of the skull here, where that meets the neck.
The exact opposite movement of where we spend most of our time, which is called protrusion. Go ahead and protrude forward. So now you get extension through here, flexion through here. Do the exact opposite. Tuck the chin, perfect, right there.
So when you do these, you can do sets of 10 to 12 at a time. On the way back, you'll hold 1, 2, 3, and then come off of it.
Not a lot of pressure, right?
1,
These
2,
are very
3,
small joints, just getting to that end range. Okay?
Yep. Okay, and the next thing, we'll dive down a little bit lower into the spine, into the thoracic spine, or the mid-back. Similar concept, we're in flexion all day. Let's combat that by going the other way. So we're going to take our hands, we're going to interlock them over our heads, bring our elbows together, and move our shoulder blades out of the way. You can kind of stay in that chin tuck position, and you're going to use the edge of the chair here, or the back of the chair, to lean over as a fulcrum. So you can come back, breathe out, and then go a little bit further. If you're comfortable with that, you can even add a little bit more force by almost whipping over the chair a little bit, so it'll look a little bit like this. Kind of use a little bit of your momentum.
Yep. Those are much thicker, stronger joints back there with the ribs in play. You can add a little bit more force, which is why we have the arms up here to get that upper back to move.
And again, 10 to 12 reps on these. As needed, you can even add in a little bit of rotation as you want. Find what's comfortable for you. Change the angle of where you're hitting in the mid-back.
Yep. Depending on the height of your chair. Yep.
That's a great way to open up those joints and prevent some pain there.
Yep, those are real good for anything having to do with the upper back, shoulder blade, into the shoulder. So
try those 3 tips out. We are your Elkhorn spine, muscle, and joint experts. So give us a call if you need anything.
Thank you.